Welcome back, Careblazer. Today I want to talk about frontotemporal dementia. So in previous videos, I have talked about vascular dementia, Alzheimer's disease, and Lewy Body dementia. I'll be sure to link to those below. But I've been getting some requests to do a video on frontotemporal dementia. So that's what we're talking about today. Now, before I get into all the specific details, I just want to do a timeout and do a quick reminder on what the difference is between dementia and Alzheimer's disease or frontotemporal dementia or Lewy body dementia or all those other types of dementia, right? I get a lot of confusion still with people saying, I thought Alzheimer's disease and dementia were the same. I thought they were different. What are all these terms? Let me just briefly recap. So the way that I typically describe this to kind of make it as easy to understand as possible is think of the word dementia as if you think of the word cancer. When somebody says they have cancer, you automatically know that something in their body is sick. Something is not right? They are sick. But it doesn't tell you exactly what kind of sick. It doesn't tell you what the cause of the sickness is. Is it lung cancer? Is it breast cancer? Is it skin cancer? Is it brain cancer, right? There's all kinds of different cancers. The same thing is true for dementia. When somebody says they have dementia or you hear the word dementia, it means that their brain is not functioning the way it should for that person's age. So their brain is basically sick, but it doesn't tell you what's causing it, what kind of specific illness. So is it Lewy body dementia, frontotemporal dementia, vascular dementia, Alzheimer's disease, dementia due to Parkinsonism, dementia due to alcohol, right? Like there's all kinds of specific types of dementia. People use the word dementia and Alzheimer's disease interchangeably because Alzheimer's disease is the most popular type of dementia. It's the one that's most researched. But really what you need to know is just when you hear the word dementia, it means that somebody's having a lot of problems with their mind, with their thinking, to the point that it's impacting their daily life and that it's not normal for their age. Now, in the beginning, the different dementias kind of can come on in different ways. They kind of start to become present in different ways and different things cause them, and they can kind of progress a little bit differently. By the end, like towards the end of the stage of dementia, like maybe moderate to severe, all of the dementias kind of start to look alike because the impairment is so great. It started to affect so much of the brain that they all kind of look similar. But in the beginning, they can look quite different. So let's get into frontotemporal dementia, specifically how that looks, what are the common symptoms that it has, and like how does it come about. So frontotemporal dementia basically affects the front and temporal parts of our brain. So we have different lobes of our brains. Two of the brain lobes are the frontal lobes and the temporal lobes on the sides. And when we talk about frontotemporal dementia, it just means that these lobes on the brain, they're shrinking, they're struggling. And frontotemporal dementia in particular tends to come on earlier than other types of dementia. So we're talking about between the ages of 40 to 65 years old, the symptoms start to come out and they start to progress. Now, in the beginning, the symptoms that tend to come out are more behavior changes and personality changes. This is a dementia where a lot of times in the beginning, when these changes first happen, because the age is quite younger than other dementias and the behavior is such a drastic change, it's not unusual that these people tend to get diagnosed with a psychiatric condition before it's realized that they actually have dementia. So some of the behavior and personality changes that happen can be kind of socially inappropriate behaviors, like losing the filter, like they forget what they are saying, or it's almost like they're saying rude and mean things in public without care about how that might impact the other person. They might become like hypersexual. They might take off their clothes in public, touch themselves in public. They might just do things that you as a caregiver is going to find embarrassing and difficult. Other behavior changes that are common are things like increased irritability, lack of affect. So this is where the person doesn't change their facial expressions or tone of voice depending on what they're saying or what's being said. So like if we were to say something really sad or hurtful, our facial expressions change a little bit, our voice might get a little bit lower. Like the person with frontotemporal dementia, sometimes it's just completely flat, whether they're saying a dog licked their face today or somebody died, it's kind of the same kind of affect. Also, in this type of dementia, people tend to have this tendency to eat a whole lot or to put a lot of things in their mouth, even things that are not edible. They just might have this fixation, this oral fixation to put things in their mouth. Language is another category of symptom that is often happening in frontotemporal dementia. So here the person might not be able to understand language completely. They might have difficulty naming things. They might have difficulty constructing a sentence appropriately, like they don't put the words in the right position. So the behavior changes and the language changes are two of the common features. Now you can have those symptoms in other types of dementia as well. So that's where it comes in, where there's brain imaging happening, where you can see the effect to the temporal and frontal lobes of the brain. The age of onset, younger kind of tips you off more that it might be this frontal temporal. It tends to have kind of a slower gradual decline, similar to Alzheimer's disease. And in fact, this dementia often gets confused for Alzheimer's disease. So the person with frontotemporal dementia, especially in the early stages, tends to have problems with kind of the behavior category and the language category, but their memory isn't necessarily significantly impacted in the early stages. So if you remember from my video on 5 surprising facts about dementia that maybe you didn't know, you actually don't have to have memory impairment to have dementia. That used to be a requirement years ago, but now you just have to have several areas of impairment of the brain. The brain is responsible for so many different activities and tasks and skills. Memory is just one of them. And so for frontotemporal, you can already see there's 2 areas, the social functioning area and the behavior personality and the language area. So those 2 areas alone are with the negative impact on daily functioning, that's enough to lead to a dementia diagnosis. So frontotemporal dementia in the beginning stages doesn't have that pronounced memory impairment that you might see in some of the other dementias. This dementia tends to come on pretty gradually and slowly, which is why some people don't get that official dementia diagnosis until they've probably had it for years. It's the behavior and personality changes that start to maybe lead that person to get diagnosed with some sort of psychiatric condition before the dementia diagnosis happens. Just like with other dementias, the amount of time somebody can have it varies greatly, from a couple of years to 20 years, right? There's all kinds of factors that go along with how long somebody lives with dementia. And it's different for everybody, from lifestyle to the help they have, to the diet they have, to the exercise they're able to do, to other health conditions, other medications, whether or not they have other dementias on top of the frontotemporal dementia, right? Because you can have more than one dementia at the same time. So in terms of, how long somebody lives with that disease, it's very wide, 2 years to 20 years. Now, if your loved one has these really difficult behaviors, these socially inappropriate behaviors, what you might want to consider doing, because it's really hard for you, the Careblazer, makes it really challenging to go out in public, and you might get to the point where you don't want your loved one to go out in public anymore, which might then reduce their functioning even further. So what you can do is you can create like a little business size card, or even a little bit bigger, that just explains very clearly and simply, my loved one has a brain condition that causes them to say and do things sometimes that are unexpected. Thank you for understanding, right? And on the back side, you can write, frontotemporal dementia, or whatever you feel comfortable with. It's different for everybody. Here's an example of a card that I made that you guys can use and tweak as you want for your own situation. This way, when you're out in public and let's say your loved one, you and your loved one are out to eat and your loved one says something rude to the waiter or waitress, you can easily just slip that card to the waiter and waitress, let them know what's going on, and in some ways that might lead to more compassion and understanding from that waiter or waitress. If your loved one is about to get a haircut and says something or does something, at least you can like just pass that to the person giving the haircut to let them know, what's going on. If anything, it really just eases your discomfort and your maybe embarrassment of what your loved one might say or do in public. Now, there is a lot of confusion, rightly so, about all the different kinds of dementias, what causes them. For frontotemporal dementia, it's really not clear what the cause, what the etiology is, but there's a lot of confusion about it. What causes it? Can anything be done to slow it down? Can we reverse it? What's with the medications? There's a lot of questions about it, and it's really confusing. I have been reading a lot of books from specific researchers and scientists who have been studying dementia, specifically Alzheimer's disease, and what, if anything, can be done to help improve it. So come in the new year, I'm going to be sharing a lot of what I'm learning so that you can maybe start to apply some of those changes to your loved one and see if you start to see improvements. The reason, so as a little kind of like a little preview of what's to come. There are medications, and I did an interview with a pharmacist. I'll link to that below on the different dementia medications, but there is no cure, right, for dementia. There is no really dementia medication that's going to truly slow down or stop the disease. Part of the reason is because it's not just one thing that's causing the dementia in the first place. And so part of what these researchers are finding is that there's a lot of different reasons that could cause somebody to have dementia, and we can start to intervene in all these different areas to start to show some improvement. So I am excited to bring that to you, to share what I'm learning with you in that regard, in hopes that maybe it would help some of your loved ones, especially if they're in the mild stages. But what I'm really hoping is that it will help you and your health down the road. Because as you know, I've talked about before, simply being a dementia caregiver increases your risk of getting dementia yourself, especially if you're a spouse. If you're caring for a spouse with dementia, you're 600 times more greater chances of getting dementia. And so I want to hopefully keep you guys as healthy as possible and prevent that from happening to you. So I think what I'll talk about coming up in the future, I hope can help your loved ones, but I also think can help you kind of make some lifestyle changes to make sure you're on the right track. So I'm excited to bring that to you. As always, Careblazer, if you have any questions or comments that you want to see me address in a future video, just like I answered the question about frontotemporal dementia today based on a couple comments I received, all you have to do is leave them in a comment below any of my videos. I do read all the comments, even if I unfortunately can't respond personally to them all. So in the meantime, keep up the good work. I hope that you guys are all doing well. I'll be back next week.